That's sorted. Thank you very much. All right, Joeeta, the floor is. What? Okay, Joeeta, the floor is yours.
Okay. Thank you. Just to clarify, when you said interested in dying and death, not particularly my own, it's just a general interest in other people's.
Right.
All right. So this paper does come, in fact, from death studies, and this is better, and particularly the bioarchaeology of care. I would like to begin by thanking the organizers for this opportunity to present in a very fascinating conference. In this paper, I attempt to identify care administered to individuals from the burials at Kalibangan using approaches from the bioarchaeology of care. Burials are stereotypically thought of as filled with beautiful artifacts surrounding a skeleton. There is certainly something to be said for the aesthetics of the grave, the manner of body placement, and the precious objects that the grave holds. But today I will be speaking of far more beautiful things: marks of love and care on skeletal remains. So, my paper is an attempt at understanding what caregiving could have looked like in times far removed from our own. And I argue, I know to a room full of historians, but I argue that burials are possibly the best way of doing this because you come face to face with the recipient of the care. And to go back to yesterday's discussion on who the sources reflect, how many recipients of care in the past can actually claim to have created the historical record versus in the archaeological? Another thing I want us to reflect on in this presentation is who is making these decisions of what sort of care is to be administered and what is the basis for the administration of such care. And we'll come back to this as I get to the conclusion. So let's begin by speaking a little bit about Harappa and Kalibangan specifically. The site I've selected is Kalibangan, a part of the Harappan civilization. As a civilization, Harappa is known for its planned cities, for its advanced pyrotechnological prowess, leading to the production of very, very beautiful objects. Some Harappan cities were also known for their drainage, their sanitation, and water management, but the efficacies of these systems have often been questioned. The Harappan culture, the Indus Valley civilization, was much larger than other world civilizations, extending from Baluchistan to as far as Uttar Pradesh and Gujarat. And its remarkable uniformity in terms of material culture distribution may be attributed to itinerant groups, including pastoral communities who were bringing food, aid, raw material, finished products for trade, as we can see, as well as news, stories, and even possibly gossip. For all their beautiful and masterful creations, evidence of status differentiation in Harappan cities largely evades us. So Adam Green argues that it was an egalitarian society. It's a very compelling argument, and this particularly then gets reflected in our burials at Kalibangan. Kalibangan itself was one of the smaller Harappan cities in the Bronze Age. You have a vague idea of where it is located. While inhabited earlier, the burial space that I will speak about is traditionally attributed to the mature Harappan period, that is roughly between 2600 and 1900 BC. Our sources for Harappa are purely archaeological as the script remains undeciphered, but I'm going to add a caveat to that. The script is found on small sections, tiny surfaces, on seals. There is the likelihood of larger portions of script being on perishable material, so we don't find them at all. Since all of these smaller script pieces come to us from an economic context, I would argue that ideas of caregiving would not be represented in the literary source, assuming we could decipher it. And therefore, decipherment does not really impact the arguments I will be making. My paper deals only in part with preventative care and more so with routine caregiving. And the reason for this is that for caregiving to be visible on bones, it would require consistent and diligent administration. It cannot be a one-time thing. And so I look forward greatly to the third presentation to see how you all are working around this particular archaeological problem. So I'm going to give a little bit of a theoretical background before I move into my data set. Caregiving needs to be contextualized, and I'm giving a little definition here that I've taken from Lorna Tilley. She views caregiving as intentional and context specific, as we have been discussing, which means that wellness and the lack of wellness are at once biological as well as cultural. Care provision is thus determined by belief systems, collective skills and experience, political, economic, and social organization, the environment, as well as access to resources. To this, I'm going to add an additional variable of social memory. The social memory of caregiving leads to the creation of knowledge within the community. In addition, caregiving is determined by the individual receiving care in terms of their status in society, the role they play, the personality that they have, and the experience of sickness that they undergo. Tilly ascribes two forms of caregiving over here. And again, this is important when we're thinking about the data sets that you were mentioning. One being direct support and the other being accommodation. So with direct support, you could have nursing and provisioning, but accommodation is where the group as a whole improvises strategy in order to enable the participation of the unwell individual in economic, cultural, and other activities. I think such a distinction is particularly important in terms of preventative care when we consider the extent of injuries experienced by laboring groups in the past and how the group would have adjusted to their short periods of convalescence. With this, I'm going to move to my sample from Kalibangan. This is not moving. Oops, okay. Went too far. Here, all right. So this is the layout of the site. And as you can make out, the cemetery is located at a distance away from the site. It's not within the confines as is traditional with Harappan sites. The Kalibangan sample is a problematic one. For one thing, for a site occupied for a good 1,000 years, we only find 88 individuals buried. Now, this is largely in keeping with what we know of prehistoric cemeteries. They're rarely representative. Further, the skeletal remains of as many as 50 individuals were lost in flood waters following the excavation. Whilst this is tragic, it is important to remember that entire cemeteries are rarely excavated owing to the constraints of time as well as financial resources. And hence, this is within acceptable methodology. So either way, our individuals are not representative of the group as a whole. So my primary question is, who are they? Why are these particular individuals being selected for burial over all others? Additionally, and the photos will bear me out on this, since the excavation and examination took place more than half a century ago, there was limited exposure to the sort of techniques that we have now in archaeometry. And despite all of these problems, the Kalibangan sample still has much more to offer to us than perhaps more recent excavations. In this paper, I am referring to the remains from the 1962-63 season. Kalibangan was excavated in the 60s. And my observations are based on the direct analysis of the anthropologist A.K. Sharma. The others from the 1963-64 season were sent to the Anthropological Survey of India and remain unpublished to this day. One of the most fascinating things about this burial space is that every individual in every recorded grave shows some form of visible affliction. And I'm going to restrict myself to the use of the term affliction to try and be a little objective about it. In many cases, these individuals with affliction were subjected to some form of human intervention that we find evidence of. So my idea here is to mark out these points of intervention and finally to build up to the argument of caregiving. The first bit that I'm looking at is the administration of burn marks as intervention. And I want us to contextualize, I'll repeat this again, but I want us to contextualize this to the idea of pyrotechnology and the importance of it in Harappa. The reason why so much survives is because it was burnt. Furnaces, metal smelting, all of these are very major in the Indus Valley civilization, and therefore the administration of burn marks needs to be seen through that particular lens rather than more contemporary one. I use the word intervention here because often the idea of inflicting pain seems at odds with the idea of caregiving altogether. But let's revisit this idea in the end. The first individual then that I'm looking at, all three, we're looking at three individuals one by one. I'm sorry, this is the only photograph available. All of them were subject to intentional and controlled burn marks. They're not, this is not the result of accidents. This is the individual in burial number 34. Buried with several beads around the neck and shell bangles on the wrists, this man approaching the age of 40 showed burn marks along the extremities of the body. So all the teeth were charred. Burn marks were administered along the lower jaw. One rib and one finger show burn marks. Most of the left thigh and the left leg also show considerable burning marks. The right hand side counterparts of each of these show no burn marks whatsoever. The most unusual feature of the burial is that the man died with his mouth tightly clamped shut. It is therefore likely that he was alive and his mobility was restrained as these burn marks were applied in a controlled manner. Similarly, the curvature of his fingers indicate that he was in fact in considerable pain when he died, and that raises the question of what exactly he did to manage to be treated this way before he died. The next one that we take a look at is a teenager represented by burial number 13. Sorry, this is not the image. There is no image of that one. The skull bore a burnt streak. The position of the limbs indicated that the body had been tied up before death. The hands were in fact tied up so strongly to the arms and the scapula that they could have almost broken from the force. It seems possible then that obviously the individual was tied up whilst the burn was being administered. And again, this raises the question as to why exactly this is being done. And the third instance, which is of this child, is what gives us some sort of answers. This child was between 8 and 10 years old. Intervention is most clearly seen with this child with the fact that 3 fragments of his skull were removed. Yeah, there we go. So you can see I've encircled that portion. And there was a long streak representing a burn mark on the skull. The upper 2 holes were also connected by extended burning marks that were made by a very pointed object, indicated by the fineness of the mark. The the skull had 12 complete scratch marks and 5 or 6 incomplete scratch marks as well. There were no signs of healing, so the interventions either caused death or were perhaps inflicted post-mortem. We would like to perhaps think of the former. A.K. Sharma states that the child probably had the accumulation of fluid within the cranium called hydrocephalus because the skull was unusually large. He contends that this accumulation of fluid was highly painful for the child. We know that hydrocephalus may present with one symptom or a combination of them, which includes nausea, fits, seizures, and impaired functioning. So this raises the question whether trephination in this particular case and the burn marks across the skull could represent an attempt at alleviating the boy's symptoms, whichever he might have been showing. And therefore, can we then begin to think of this as certain forms of caregiving, very, very different from our own? I add an additional dimension to this, and that is that the performance of such administration of burn marks may have had an additional ritual nature. Possibly because, for one thing, we know of this happening in other contexts in the past. But again, the pyrotechnological prowess of Harappa needs to be remembered in this context. And therefore, it is likely that there are additional symbolic elements with this administration of burns that we see with these 3 particular individuals. And whilst this rests on relatively sketchy evidence, we move to stronger evidence with caregiving in the next slide, in the next section. Just waiting for this to change. Yeah. And the reason why I put this up is I also wanted you all to note the beginning of permanent dentition somewhere around the nose that's going to come and replace the milk teeth. So obviously a very small child that this has happened to. The next 2 instances that I'm going to be looking at are going to be of paralysis, but we take a break in the middle to take a look at how these individuals dealt with injuries. The individuals in burial numbers 8 and 11 showed exostosis. This is noteworthy because of the evidence of care it provides. This is likely to have taken place because of the healing of a particular injury. And this tells us that there is sufficient corpus of knowledge that is enabling the survival of people with very harsh injuries. And this is sort of my intermediate step towards caregiving. The final and most direct evidence of caregiving comes to us from the remains of 2 paralyzed individuals. The individual represented by skeleton number 8, and again, these photos are from the 1960s, so they're not the best. The individual represented by skeleton number 8 had deformities of the limbs and the pelvis. She was identified as a teenage girl. And although this brings a sense of discomfort, A.K. Sharma felt that unlike other individuals, her corpse had just been dumped carelessly into the grave pit. We do not know if the creators of the burial considered her placement within it similarly, or whether a paralyzed body with rigor mortis prevented them from their general affective body placement style. So we take that argument with a bit of criticality. But she was buried in a very traditional Harappan manner with 7 pots, and her grave per se did not look different from anybody else's. The burial of the other paralyzed individual, identified as skeleton number 9, stands in significant contrast. The bones of his limbs on the left side were deformed. His right foot were also deformed. This is Sharma's terminology, not mine. Perhaps as a result of osteoarthritis. According to Sharma, the bones of his hands were badly twisted as well. The anthropologist's examination concluded that movement was greatly restricted in the affected limbs, thereby limiting the extent unto which they could have been used. His right foot also showed disabilities in terms of the fact that these were from childhood and not recent. So the individual represented by this particular skeleton, that did not change, would have retained the function only of a single arm and a single hand. The mobility of his feet would have been impaired and he would have required assistance in any form of movement. The lack of severe injuries to his body indicated that his disability was managed well. Care was taken to ensure that he did not fall and injure himself, at least to the extent where bones could have been broken from childhood. In his grave, another feature stands out. Okay, this was great. This is the other feature that stands out. The excavators found a large ear ornament, a large shell bangle by his head, which was fashioned as a ear ornament, making him the most fashionable of our group, and therefore quite an interesting person, one whom my heart goes out to. There were also additional charred bones here. I'm being told I'm running out of time, so I'm going to rush through this a little bit. So individuals with paralysis would have required assistance in the satisfaction of their basic needs of food, water, shelter, as well as day-to-day activities and transport. Besides these, additional aspects of care, ensuring personal hygiene and safety would be a priority. For open wounds, regular cleaning would be necessary, and none of the bones show infection strong enough for the creation of lesions, indicating that these individuals were very well taken care of. There are also marks that we cannot identify, but that we can kind of indirectly think of. Emotional and mental well-being is not going to leave a trace on the bones, but in order to have cared for disabled individuals over such a long period of time, paralyzed individuals for such a long period of time, mental and emotional well-being would have been something that the group as a whole would have had to take care of as well. There's additional evidence, but I'm not going to go through that. I'm just going to come down to my main arguments. So how do we then think of care provision? In a cemetery, we do not see a moment in time. The provision of care rests on a body of knowledge accumulated over generations. Care also lies between two realms, the realm of specialists or those imbibed with daily practices of individuals within the group. It is clear that the participation of several individuals was required to maintain an atmosphere that aided the individual's survival. And whilst we only looked at a few instances, we obviously know that care is something required throughout the lifespan and by the community as a whole. All these skeletal remains reflect a body of social values, knowledge, and skill that was derived from collective experience and social memory. The lived experiences of each individual and those surrounding them would thus be shaped by a body of existing thought. These individual experiences would further have contributed to modifying and expanding the ideas of the collective in dealing with such situations as they emerged. And again, in the interest of time, I'm going to run to the conclusion. Through the examination of skeletal remains, we are able to access the lived reality of the individual. And while we are bereft of skeletal remains of caregivers, we certainly do see the impact of their work. So going back to our original question, who do we find in the Kalibangan cemetery? Well, only a fraction of pathologies is registered on bones. For the most part, these are individuals who survived situations which otherwise would have been fatal. Their bones live to tell us the tale. And how do we then engage with the identities of the recipients of care? Each of these burials, as you can see here, was carefully provisioned with food and beverages for the afterlife. Burials like these, after all, are found all over Harappan sites. The graves and the space around the graves, and this is unique to Kalibangan, were also spaces likely to be of rich ritual because these spots were left exposed over time, indicating perhaps that people revisited the graves regularly. And in the midst of all of these individuals, whilst it might seem like an aberrant practice with those who are unwell, we have one truly remarkable individual whose bones showed no sign of pathology, but in fact had 70 pots placed under his body. So therefore, I argue that these are not marginal, not the individuals, not the practices either. And ultimately, what does our exploration of caregiving in the faraway past offer the contemporary? It makes us rethink the implications of caregiving and acknowledge more fully the conflict it creates. In a world that finds comfort in black and white, with a lack of nuance and a lack of problematization, it reminds us that cherished ideas hold the possibility of good and bad, and that watertight compartmentalizations must be eschewed for the blurry. Thank you.
Many thanks, Dr. Pal. That was fascinating. Lorna Tilly is a friend of the project, as you may know. So nice connection there. We move swiftly to our second paper on healthcare in early South India, an epigraphical perspective, and our speaker is Dr. Amol Saghar. Over to you.
Thank you, Professor Gill. No, well, since yesterday, the focus was primarily on the literary sources and on the period of the medieval and the early modern. Um, Today's first paper again takes us back to almost the pre or the proto-history period. Um, so this paper is basically on early South India, that is ancient and early period, that is post Sangam period, post 3rd century CE. And it basically looks at how healthcare facilities or healthcare, what the meaning of healthcare was in early South India. And my work is basically based on inscriptions. Rarely do I, in the present presentation also, you will see that rarely will the literary sources like um, Chilapati Karam or Mani Mekkalai or even Matavilasa Prahasana would appear. So to begin with, the present paper, the time frame of the present paper would be roughly around 4th to 12th century. That is around the period of the Pallavas and the early Cholas, and also the Chola period and the basically the pre-Vijayanagar period. So the healthcare aspects related to healthcare were for a very long time outside the purview of, I'm talking in the context specifically of South India, were outside the purview of history, of historical studies. In fact, to cite an example, there was this work in 1905 by Alan Butterworth and V. Venugopal Chetty, copper and stone inscriptions of South India, where they categorically write, and I quote, "The work was undertaken in the belief that the records of a district situated as Nellore would contain a lot of new matter of historical importance. This hope has not been realized. The great bulk of inscriptions consist of grants to tanks and temples which are of no interest." This is very categorically they mention in the book. And unfortunately, this is a trend that continues almost till the 1970s, because even scholars like Neelkant Shastri, his student Mahalingam, and also Minakshi, and the early works in the post-independent era rarely touched upon aspects related to healthcare, related to non-political aspects. Basically, they mostly tried to look at the administrative structure, they tried to look at the genealogy, they tried to look at the political changes which were taking place between different dynasties and all that. and of course, the concept of village community and the extent of the Chola Empire in the context of Burtonstein, or in the context of Subrialu and Burtonstein. So it is only in the recent times, especially under the influence of scholars like Frank Zimmerman, D.N. Jha, Om Prakash, in the context of early North India, that scholars, even in southern India, have started to shift their focus on aspects which had nothing to do with had nothing to do with political history, but actually affected the day-to-day activities of the common people. And health is one of those aspects. Um, while in the context of North India, there is, because of the presence of Mauryan Empire and the readily available sources of the Mauryan Empire, especially during the reign of the Ashoka and his stone and his charters, you get to see references to healthcare that were initiated by Ashoka and by the facilities that he tried to introduce as far as healthcare facilities were concerned. Of course, Professor Romila Thapar has tried to look at it in some detail in her work on Maurya and on the decline of the Mauryas and Ashok. But in the context of South India, even though there are inscriptions that talk about the healthcare facilities, they are not as yet tapped into. I should make this very clear that the inscriptions don't directly, there are majority of inscriptions that rarely talk about healthcare facilities. Let me be very clear about this. And the inscriptions that do talk about healthcare facilities, they focus primarily on the physicians. Rarely do you, and especially around in the pre-12th century, that is during the period of the Pallavas and the early Cholas, you rarely get to see aspects related to hospitals, aspects related to medicines. But basically, what the inscriptions are focusing on are the physicians. Most of these physicians are Brahmins. That is one thing that comes out from the inscriptions, because the Gotras are mentioned, their identity is mentioned, and they are being given land grants. They are being exclusively given land grants. In some inscriptions, they are one of the many donis, but there are inscriptions in which the land grants are made exclusively to them. The second thing that I would like to bring your attention to is the fact that by the time you come to the 500, by the time you come to the 6th century, most of the medical profession, most of a large part of medical profession was overtaken by the Brahmanical institutes, and they tried to copy the concept of vihara, in the sense that they tried to place, and there are inscriptions which show that physicians were part of the sacred center of a temple. They actually worked inside the temple. They were not removed from that, they were part of the temple, which actually shows that how important that actually shows, and this is very different from the literary texts, that they were not considered low in the social order. And this is something that we have to keep in mind, that what is there in the prescribed text is actually not on the ground. You don't find that on the ground. As far as inscriptions are concerned, the physicians are considered as important people. For instance, in the Tandan Totem plates, which is in the reign of Pallava ruler Nandivarman II and dates to around 8th century, you find that the doctor, the name of the doctor, the physician, is Parameshwaran, and he actually is given around 3 shares of fertile land to exclusively, the grant was made exclusively to Parameshwaran. There is no other doni to it. And the interesting thing is that in all the inscriptions where the grant is given to the physician, his qualifications are highlighted, his medical expertise is highlighted, and actually a eulogy is written around him. Why I say him? Because in almost all the inscriptions that we have come across in South India refer only to male physicians. There are no female physicians who are mentioned in any of the inscriptions that we have. Um, then there is an interesting thing is that physicians in this period were not restricted to only medical realm. There have been instances, there are inscriptions which show that physicians were also involved in politico administrative affairs of the state. To cite an example, they actually acted as witness to political treaties between different rulers. An example is the Bantra inscription of Nripamalla Raja, which dates to mid 9th century CE, in which a physician is referred to as Marudagal. In the record, there's no name, it's only his position that is mentioned, Marudagal, or Sadanura Marudagal, which is physician of the area of Sadanura, okay, which is basically in today's time, it's basically in southern Andhra Pradesh and bordering Karnataka. So he appears as a witness between four parties, and the parties are Nripamalla Raja, a ruler belonging to the Kadamba dynasty whose name is lost. Please remember, Nripamalla Raja is not the Kadamba king. Okay, the name of the Kadamba king is lost in the inscription. There is no reference to the Kadamba, which ruler is being referred to. And there are two brothers, Rachamallan Dugaraja and Narsingham Durgaraja. And the treaty actually is about that these four parties should cease all kinds of violence. They should stop fighting between themselves and they should look for peace. That's the treaty. And in that treaty, this physician is an eyewitness, is a witness. Um, Secondly, we should also assume that we should also keep this in mind that physicians, like Brahmins, were not a homogeneous group. There was substantial number of physicians who we are sure lived in poverty. They actually worked, as Professor Nadeem yesterday was talking about, in the sense of that picture, in the context of that photograph, that you have that bazaar and you have the physician. So that kind of references actually are found in our sources also, especially in the literary sources. For instance, in Sambandar, who is the Nayanar saint, when he talks about Kanchipuram and when he talks about the vibrancy of Kanchipuram and the bazaars, he makes note of this thing that there is a couple of people, he doesn't name them, but he says that there are physicians, not physicians in the sense, he doesn't use the word physicians, but he says that there are medicine sellers that are also part of this, like flower sellers and others. There are also medicine sellers. So he makes a reference to it, even though it's a passing reference, but we do get an idea that there are these people who are there. This is also an important thing, that that physicians who were financially stable, they also took active part in construction activities. It's not that they only restricted themselves to medical profession. They were actually using their wealth to construct pillars, to construct grand pillars, tanks, water wells, and etc. For instance, in the period of Ikshvakus, that is around 300 to 400 CE, you have an inscription called as Panigiri inscription. In that inscription, you have a pillar, mention of a pillar named as Dharma Chakra. And the physician who built it was known as Demasena. He is actually mentioned as Agrabijasa, Agrabishaja, who is actually a term used for a physician. So he's a Demasena. The name of the physician is Demasena, and he was responsible for constructing a grand pillar, very well carved and grand pillar, in the center of the city. So we can safely assume that physicians, just like Brahmins, just like other communities, were taking active part in construction activities also to make their presence felt in the society. 5 more minutes, right? So now I can go on about the inscriptions. I can also talk about how physicians were central to many of the inscriptions that we find, even of Chalukyan empire, of the Chalukyan dynasty. Same is with the Hoysala dynasty, the later Cholas, for instance. But I'll actually try to shift my attention to another aspect, which is the medicine. Okay. I have said in the at the outset that references to medicine are not found. They are found, but they are very scanty references. But the interesting thing is that there is an inscription. I, uh, I'm sure you must be knowing about this. Tirumukuddal inscription belonging to Veera Rajendra Chola. It is an 11th century inscription, and till date, it is the largest inscription found in the Indian subcontinent. In that inscription, it is important to know that that inscription is important because it is the only inscription that details the medical profession, medical procedures, the medical staff who were there. There's a mention of a hospital which was constructed at a very critical juncture of the confluence of three rivers, Chayar, Venagatta, and Palar. These are three rivers who are, and the confluence of which Veera Rajendra built this clinic or this health facility. It was a 15-bedded hospital, and there were among the staff there was a physician who was actually the overseer of the workings of the hospital. There was a surgeon. There were two female staffs who actually were responsible for administering medical dose, the prescribed medical dose to patients, and cooking food, of course. And there were two male physicians, male nurses, who were responsible for collecting for firewoods, and then making medicine out of it. But the interesting thing is that this is the only inscription in which the names of medicine and for which disease they will be used are mentioned. There is no other inscription as far as South India, early South India, pre-Vijayanagar period is concerned, where this kind of information is available. And and scholars say that we can assume on that basis that such type of medicines were being used in other hospitals also. It's just that they were not, just like today. I mean, even today, it's not like every time we mention aims in our work or we mention that this medicine is used for that, it is known. So it doesn't mean that in the records it has to reflect every time. But this is the only inscription, and on the basis of this, one can assume that these were medicines that were. I'll take just 2 minutes. That these are medicines which are being used throughout in many parts of the country. There is South India, sorry, early South India, and finally. I just wanted to draw your attention to two more things, and then I'll wind up. One is diseases. There are, except for this Tirumukuddal inscription, the reference to diseases are not very forthcoming. Of course, there is an inscription by Nandaluru inscription that is dated to around 13th century, mid 13th century, and belongs to the Anamya district of Andhra Pradesh, where you get a reference, a passing reference to an epidemic disease called Marijwara. Scholars, according to the scholars, I'll just find it. The scholars who have tried to see the symptoms of the disease, they have tried to compare it to plague, but a localized plague. It was not a kind of pan-Indian or a early South Indian plague. So there are these kinds of passing references. We can assume that there were diseases. For instance, famine was a common thing in early South India. We do find several references to famine, even in literary works of Nayanar saints and in the inscriptions also. And finally to conclude, before the rise of the Vijayanagar Empire, because by the time you come to the Vijayanagar Empire, there is an efflorescence of inscriptions. Each and everything is being recorded. That kind of thing is not available to our period, except by the time you come to the end of the Chola period, when the Brihadeshwara temple is built and all that, and when you have records of a medical school and all. We don't come across these kinds of inscription where one can completely say with with confidence that this was a medical facility. This was because majority of the medical facilities were attached to temples. They were not independent buildings. So prior to the emergence of the Vijayanagar Empire, the information about healthcare is not very forthcoming in the specific context of South India. You only try to read between the lines and try to assume from some of the inscriptions that make passing reference to physicians, so passing reference to medical facilities, that these were something which were common to many parts of South India. So I'll stop here. I'll stop my monkey bath here, and I'll let the others do whatever discussion is there. We can carry on from there. Thank you.
Thank you very much, both of our speakers, for keeping to time. This is our moment to introduce the tech miracle, which is the switching to our Zoom presentation. And it is my very special honor to welcome my dear colleague Giovanna Bianchi, who I believe is speaking for the entire Siena-based team of our project.
Thank you, guys.
Okay.
Sorry.
Nope, go ahead, Giovanna. The floor is yours. We're all hearing you and seeing you very well. Go ahead.
Thank you, Guy. Good morning to all, and thank you to the organizer of this interesting conference. And our research is set within the broader project directed by Guy and focuses on rural central Italy, particularly Tuscany, during the end of the 12th and 14th century. During that period, the countryside of Tuscany and much of central northern Italy were at the center of political ambition of both minor and major aristocratic family, as well as the cities that took control of large portions of rural areas during the 12th century. The development of the city was part of general economic growth that began to accelerate in the last decades of the 12th century. Economic growth required a larger quantity of coins for trade. For this reason, the end of the century marked a sort of a great rush in Tuscany, as in other parts of Italy, for the raw material needed to mint coins, copper, lead, and silver, especially small ones. The main history of our castle unfolds within this scenario, when a local aristocratic family, in response to the increased demand for circulating money, decided to invest heavily in the exploitation of a mining area through his own castle, located at the heart of a mineral-rich territory. Although the castle already existed in the 10th century, a major investment was undertaken at the end of the 12th century that led to its complete reconstruction, planned down to the smallest detail, which also included a church with a cemetery and an area for the processing of ore. The castle destiny was closely tied to mining activity and its gradual abandonment, starting at the end of the 14th century, and this abandonment depended on the declining interest from the local noble family due to the development of other important mining districts. The story we aim to tell intertwines the action of the aristocratic family and the small community that lived in the castle during this year. Very few documents refer to the history of the castle, and even fewer refer to its inhabitants. Material evidence, therefore, gives voice to the small world, one that would have remained unknown without the archaeological excavation carried out at the end of the last millennium. Thanks to our project, we were able to revisit the documentation through a new research approach focused on health and prevention within this community. From the start of our work has focused on analyzing the burial in the cemetery established between the 30th and 40th century, the only case in Italy of a cemetery from this period located in a mining site. The case of Rocca San Silvestro was not an easy context to study, as it was not obvious that most of the community made up of men, women, and children was exclusively engaged in mining activity. Specific markers had to be defined through a precise line of investigation. The analysis of the skeletal remains was therefore our starting point, but in order to fully understand the lifestyle and health condition of the community, the anthropological data had to be reinforced by data from archaeobotany, zooarchaeology, and geochemistry. A working protocol was therefore developed to answer the macro question of the research. What action were taken by the aristocratic family for the well-being of the community? And conversely, what action were taken by community to preserve the lifestyle and health? In our multi-voiced presentation, I will therefore leave the floor to Serena Viva.
Thank you. The anthropological study at San Silvestro began with an analysis of the cemetery area. This presented a unique opportunity to study a statistically significant skeletal sample and to correlate in-depth biological data with information about the surrounding context. The application of several anthropological methodologies allowed the examination of numerous biological aspects of the sample. Sex and age at death were estimated to determine mortality trends within the community. Biological characteristics such as stage, pathology, stress markers, and trauma are critical to reconstructing lifestyles and delineating health conditions and activity patterns related to occupation and surroundings. These analyses were carried out on 194 individuals. The majority of these were non-adults, with adults making up less than half of the sample, 41%. Among the non-adults, 45% were in the 0 to 1 age group, highlighting the high infant mortality rate typical of the period. Among adults, there was also a male prevalence of 59%. And when we distribute the estimated number of individuals of each sex into the different age groups, we observe higher mortality rates among males between the age of 20 and 40, and conversely, a female prevalence over the age of 50. The examined community is heterogeneous with all age groups and both sexes well represented. Despite the high infant mortality rate, those who reach adulthood appear to have a relatively high life expectancy for the period. Analysis of stress markers on skeletal remains indicates that a significant number of individuals suffered from anemia, with some cases of scurvy, which is a condition caused by a lack of vitamin C, tooth enamel hypoplasia, which indicates the effect of physiological stress during tooth formation, is prevalent, while Harris line on the tibia, which are a sign of a temporary arrest of long bone growth, have been documented in some individuals. This evidence suggests that living conditions were particularly stressful, yet individuals demonstrated remarkable resilience during their growth period. The study of trauma plays a key role in interpreting the community's socioeconomic context and lifestyle. In Rocca San Silvestro, trauma is generally low in severity, but high in incidence. The absence of compound fractures suggests that medical intervention is effective in reducing injury. The high frequency of injuries can be traced, at least in part, to the local geomorphology and rural environment conditions, which impose heavy, repetitive, high-risk physical activities. 60% of the sample show at least one trauma. 64% were males, while 36% were females. This is probably because males were employed in riskier tasks, which is consistent with the increased mortality observed between the age of 20 and 40. A differential diagnosis approach was adopted regarding working condition in mines because miners worked in cramped conditions with poor lighting, breathing in moist, polluted air, and facing the risk of collapses and falls while lifting heavy loads. These conditions could result in squatting postures, head injuries, fractures, respiratory diseases, and increased upper limbs robustness and vertebral arthrosis. Together, these factors could indicate mining activity and allow the development of the diagnostic protocol. The absence of severe head injuries suggests the use of protective equipment, such as leather headgear and the safe management of mine, particularly regarding carrying suspended loads. In the female samples, signs typical of mining are less evident. However, some individuals performed extremely strenuous physical activities and exhibited advanced arthrosis. A study of the robustness of the enthesis of the upper limbs shows great robustness in the male sample. In contrast, the females appears to have been employed in more diverse activities, which probably included ancillary mining tasks such as transporting, crushing, and roasting ores. The archaeobotanical and zooarchaeological data also confirm that within such heterogeneous and self-sufficient community, economic activities were diversified, with some individuals engaged exclusively in agriculture and others in animal husbandry.
The analysis of charred seeds and fruits of cultivated plant species enabled us to reconstruct medieval crop resources and agriculture technologies. Remains dating back from the first half of the 13th century shows that cereal cultivation was the main source of agricultural production. Wheat and barley, characterized by their large grains, high yields, and nutritional value, were fundamental to the agricultural economy of the period, with wheat in particular facilitating bread-making processes. Although the surrounding land is not ideal for agriculture, topographical analysis has identified some flat areas that can be cultivated despite slopes up to 20% degrees. These plots were suitable for subsistence farming and were in use at the end of the 19th century. They represented approximately 4 hectares of potentially cultivable land located relatively far from mining areas and mine waste deposits. Cultivating wheat and barley maximized the local ecological conditions. Barley, resilient to water stress and poor soils, complemented wheat, ensuring diversification and reducing famine risk. This reflects systematic agriculture planning for a resilient rural community. An oil mill has been identified inside the castle. The context of its discovery, together with the presence of olive stones, suggests that the fruit was harvested and processed there for oil extraction. Timber was vital for mining, metallurgy, and local domestic activities, used both for tunnel reinforcement and fuel production. Analyzing charred wood has helped us understand the exploitation of forest resources, as well as the forest dynamic changes. The charcoal record reveals the use of wood from mixed forests composed of evergreen species in red and deciduous trees in green, in an ecological mosaic of open exploited woodlands in which areas of regrowth alternated with more degraded areas. Periodic cycles of felling and regeneration maintain a high level of floral richness until the mid-14th century. The cultivation of olives altered the natural composition of local forests and provide a source of wood, suggesting strategic control over the local environment. The zooarchaeological analysis carried out at Rocca San Silvestro focuses on the study of faunal remains recovered from waste disposal areas within the castle. These deposits yielded a substantial and chronological well-defined osteological assemblage, which enabled an in-depth investigation into the livestock management practices and dietary habits of the mining community. By applying the diagnostic zone method, it was possible to carry out the taxonomical and anatomical identification of the faunal remains, determine the slaughter age of the main domestic species, and analyze butchery marks on the bones. This data allowed for the reconstruction of the production systems and consumption practices adopted by the community at the time. The analyzed assemblage is predominantly composed of domestic species remains, which form the core of this study. In particular, these include pigs, sheep and goats, and cattle. Among these, pigs are the most represented species, accounting for over 40% of the identified individuals, while sheep, goats, and cattle each represent approximately 20% of the total. The slaughter age of pigs shows that the majority of individuals, approximately 60%, were butchered before reaching their second or third year of life, corresponding to the so-called meat optimum. A smaller portion, around 20%, were slaughtered at a juvenile age, before their first or second year, while the remaining individuals were kept until adulthood, likely for breeding purposes. The wooded areas surrounding the Rocca were likely used for free-range pig grazing, allowing exploitation of forest resources such as acorns for feeding. Sheep and goats were primarily raised for their meat, although secondary products such as wool and milk were also relevant to the economy. Despite being less numerous than other species, cattle played an important role both as a source of meat and as working animals, as suggested by the advanced slaughter ages, over 4 years, observed in some individuals. The distribution of anatomical elements of the main domestic species indicates that primary butchery operations were carried out within the castle, likely near the designated areas, with a marked preference for the meaty portions of the forelimbs. The lower frequency of elements from the hind limbs may be attributed to redistribution practices within other parts of the castle or to their transfer outside the settlement. Finally, the analysis of butchery marks reveal redecoarse carcass processing. Chop marks, almost exclusively produced by heavy tools such as cleavers, are rough and concentrated on specific anatomical segments. To reinterpret Rocca San Silvestro metal ore processing, 2 multidisciplinary archaeological and physiochemical surveys were launched in 2023, including areas within the settlement and the surrounding territory. Analyzing the chemical composition of soils allowed us to identify the chemical fingerprints that mining and metallurgical works left on the historical landscape. This last hosts outstanding mineral deposits of mixed sulfide ores that were exploited to produce copper, lead, and silver. In our study, specific chemical elements such as lead, copper, and zinc were used to mark to markers of activities related to the processing of local mineralization. Samples from historically rich mining areas were taken to set a baseline heavy metal contamination level. Field surveys using a portable XRF provided chemical maps of the area. Measurements inside the settlement were taken in metallurgical, uncertain function, and residential areas. In total, over 1,300 site measurements and 250 in surrounding mining areas were collected. Geochemical analysis reveals that the highest contamination values for copper, lead, and zinc were found in the areas already identified as metallurgical. Comparing those values with those from spaces of uncertain function and residential areas, we can firstly assess that the metalworking zones are larger than excavation identified. Residential areas have significantly lower levels, remaining substantially cleaner.
Okay, in conclusion, thanks to our investigation protocol, we can therefore answer the macro question posed at the beginning of our presentation. The aristocratic family who owned the castle was concerned with preserving the health of the community, planning the settlement with precision and clearly dividing the area used for processing ore from those used for housing. Despite the size of the industrial area compared to the overall layout of the castle, this choice proved to be a successful one, as demonstrated by the low levels of contamination found in the houses. It's possible that the Lord called in specialist worker both for processing the ore and above all for securing the hill and mine where some of the castle inhabitants worked. The lack of obvious trauma, for example, to the head, could be indicative of fairly safe organizational management of mine. Conversely, the inhabitants of the castle implemented a strategy to safeguard their health and lifestyle. They raised animals and butchered them inside the castle, cultivating cereal and olive tree with some skill in the area surrounding the site. They obtained medical assistance, perhaps facilitated by the lordship themselves, as demonstrated by the absence of compound fractures. This does not mean that life at Rocca San Silvestro was without hardship, but the community's well-organized division of labor, mining, agriculture, livestock farming, made it resilient and gave it a much better quality of life and longer life expectancy than other archaeologically investigated community living in the nearby castle devoted only to agriculture. And thank you.
Thank you very much, Giovanna. You've heard the voices also of Seren, Viva, and I believe it was Andrea and not Mauro. Am I right?
Yes, it's Andrea Tommolini.
Okay, Andrea.
And
Okay.
Mauro in the PowerPoint.
Mauro. Okay, very good. Pardon? Yeah, okay, no problem. Okay, we will, so thank you again to all of our speakers. We have 20 minutes for discussion. So 20 minutes separate you from tea and coffee. Try to bear with us. A lot of thoughts and stimulating ideas are coming up. We already have a question. Okay, we have 20 minutes. If you are on Zoom and want to raise a question, please raise your hand so it will be easier for us to see. And of course, if there are questions here, please let me know. Would you like to? Okay, just wait for the microphone so people on Zoom can hear you. Thank you.
My question is to Bianchi. You know, you made a very interesting presentation where we liked, the way you looked into the question of miners. when you were referring to, horse riding and other things, horses, use of horses, and they, when you are using horses over a period of time, it, bends your legs. Do you find any kind of bending of legs of these, skeletons which you are finding? Because they adversely impact the bones.
Did you hear that, Giovanna?
Just a little, sorry, I don't understand the question, or is it for Andrea for the horses? I understand.
Yeah, maybe I can just jump in on
Okay.
the question.
Yes.
So if I understood correctly, you're asking about if we found any evidences of horses with pathologies on their legs. Am I right?
Yeah.
Okay, so that's
No,
something that obviously we were looking at, not only on horses but also on cattle, because we know that they were used for for work in the fields in those areas. Unfortunately, we did not find evidence pointing out to splitting metapodials, for instance. So we did not find any kind of pathologies related to the use of workforce as for horses, for example.
does that answer your question? Yeah. Okay.
So weren't you asking about the horse riders and not the horses?
No, horse riders.
The horses. Yeah.
They don't have any.
There are not a lot of knights going on around there. Yeah. Thank you, Andrea. Other questions?
Thank you very much, Dr. Paul, to present your presentation. Do you have any idea that what would happen to that child, that he was in such a petty condition before his death?
The sense that all observations were by A.K. Sharma, and so it was his conclusion that the skull had enlarged because of the extent of fluid. But there is no, I don't think there would be a definitive way of saying which symptoms the child was exhibiting, whether he was okay with the fluid accumulation and showed no symptoms, or whether it was pain and other things.
No, that is not the. At that time, at that time of Harappa, that very similar condition was in the Babylonian condition, Assyrian condition, and the Egyptian medicine. And these is prehistorical medicine. At that time, the thoughts were made on the faith. And at that time, that child was suffered by the hydrocephalus. So they thought that there was a point of health belongs to the god, and the sickness belong to the evil and ghost. So to came out to make a way from the host to come from the skull, because they thought that the host or evil had a seat inside his skull, and that's why the physician come priest, because at that time the priest was also the physicians, and the hospital was adjacent to the temples. So that's why they had made the burr holes in the skulls, and they had burned the body parts to stimulate the horse to ejaculate from the seat, to come out from the body. So that was the type of medical care at that time, and because there was no anesthesia, so that's why the hands and legs were tied. Okay, so this is the philosophy of that time, and that is the mirror of that time. So you have to look into the burr hole, a skeleton, categorization, and the power of the host and evils, and the evil and the god. That
So
will be
I need to completely disagree, because I think when it comes to Harappan religion, we don't know anything. There is some little bit of definitive evidence that you get from a site like Kalibangan.
because there is a hole some in the skulls. The child had suffered by the hydrocephalus. His hands were tied at that time. And
His hands were not. Yeah.
And those marks are not simple burns. That were the marks of the cauterization. Cauterization means the pushing of the fire on the body parts to give the pain to the host, not the patient.
How would we know? I mean, for all trepanation, our context is different.
You have to go to the Illustrated History of Medicine, very voluminous book, and there you will find these things. Thank you.
I think the context is too vastly removed, because we see this from the Neolithic times as well, and the meaning would be different.
Oh, okay. There are conversations we can also continue. Please.
Thank you. It's an inference that goes thing is that. Now I wanted to know that these burn marks do you find in other civilizations like Egyptian, Babylonian? So on their skeletons, how they were treated? What kind of marks do we find there? Are the burning or burning is very specialized to us? To the Indus. Have you compared it with others?
I have not compared it, and generally, so far, physical anthropologists tend to compare more with patterns of migration coming from Iran, rather than looking at this cross-cultural comparison between the large civilizations. But thank you so much. I will look into that.
Thank you so much, Joeeta, for such a fascinating presentation. So I just have one small question. Do we have any kind of a knowledge about the social classes that these people getting buried belonged to? Because there have been theories, by historians who have worked on such civilizations, and there have been theories about social fragmentation being present in these societies. So, do we have any knowledge as to what kind of social classes they belong to? And then my next follow-up question would be that do you think that or have you found any kind of differences in the way people belonging to, say, for instance, if we can use that term, lowest social strata were buried vis-a-vis people belonging to the higher classes? So this was my one question to Dr. Joeeta. Dr. Amol, again, very, very fascinating presentation. And since I have very little knowledge about the period that you are referring to, one thing I found which was very interesting in your presentation, and my query follows from there, is that when you started your presentation, you categorically mentioned that the physicians in South India, they predominantly belonged to the Brahman, Brahmanical class, right? And we also know about the presence of the caste system in the pre-Vijayanagar period, right? It was very much there. So then, do you think that when you make this argument that the priestly class were placed at a very high pedestal, in the sense they had a very high social ranking in South India, do you think it was because of their profession or because of the fact that they belong to the Brahmanical class? And also because you also made this point that hospitals in South India during the pre-Vijayanagar period, they were predominantly situated within the temples. So this again, reiterates the same argument that it was the Brahmins who were, capturing the majority of the viharas within the temple. So probably that was the reason. And do you have evidence in your inscriptions? Since you mentioned, I think you mentioned two words which referred to physicians, which were there in the inscriptions. Do we also find reference to the mention of their castes by a particular word when they are being mentioned in their inscriptions? So whether the eulogization is because they were physicians, because of their professions, or because they belonged to a higher caste category.
So we start with you as the last question, and then we'll move to
Thank you for these questions. Um, since there was a paucity of time, I couldn't go into the details of this. Yes, predominantly these were Brahmins to begin with. Whether these Brahminical physicians had people under them, we are not sure. Secondly, there is a word called as parahita that is used by the time you come to the Hoysalas, that is around the 12th century, 13th century, that 12th century, that by the time you come to that period, parahita is actually being used as a title. They are being bestowed with a title that people who are involved in addressing the sufferings of the people, and mainly physicians, and they are known as Parahita. Now, there is one family known as Parahita Acharya, whose family is actually he belongs to a family, a medical professions family, and all of them are Brahmins. Their gotra is mentioned, their residential area is mentioned, which is very typical of a Brahmin. This thing, you will not find such type of mention of gotras and all for other kinds of caste, for instance, lower. In fact, lower orders physicians, of course, they never appear in the inscriptions. Even in the inscription that I mentioned of the Chola period, the longest inscription, there also you only get to know about the physician, who again is a Brahmin. He is given the charge of the hospital. He is asked to look after the workings of the hospital. The grant is made in his name. He actually gets the highest salary in form of paddy, and he again is a Brahmin. But other caste group, other people who are there attached to the hospital, including a barber who was given the responsibility of carrying out minor surgeries. The barbers were allowed to carry out minor surgeries because they had those tools. So that kind of thing, the other castes, other people's castes, and women, of course, you will never get to know the caste of the women. Yeah, yeah, yeah. They could they could practice there, they could stay there, they were given food there, they were given accommodation there. So that's the reason why I was saying that inscriptions like the Pallavan inscriptions or even the Chola period inscriptions are very far removed from the prescribed texts. They are not considered as lower or untouchables. They are actually given importance. They are actually given prime land within the area that is there in the temple. I'll just take one more minute. And also please remember that the grants that are being given, which I've just mentioned, that exclusively they were being made to the to the physicians. They are all Brahmins. There is no other caste that is being given to this thing. And also we should remember that the caste system that we know today in the period that I am discussing was very fluid. It's not like there is a fixed caste that if you are a lower order you cannot practice this. There are people who are known from there are people like Brahmins who are known to have practiced things which are considered today low demeaning, especially in times of emergency. There's a term that is used for emergency that I am forgetting the term. So they are allowed to practice, and they did that. Even there is a reference to Agastya in Manimekalai, which is actually inspired from Mahabharata, that he actually steals dog meat from an untouchable's house because there was a famine. So these kinds of references are there, and we should remember that caste system that we usually use the word caste in a very kind of matter, in a very kind of in we take it for granted that caste has been there since time immemorial, but actually caste system itself was very fluid. So I think that answers your question.
Yeah, I also had a question, but yeah. So in terms of, I mean, you asked about classes. So I'm on the bandwagon that suggests that Indus is exceptional, and you genuinely don't see such major differentiation. It is very difficult to identify because for every argument that was previously made of a non-egalitarian society, you do have a very legitimate counter. So, for example, what would be objective evidence to suggest that certain groups of individuals have better access to housing? It could entirely depend on the nature of production that was happening within the household. In terms of nutritional differences, you are able to see a change in the post Harappan, in the decline phase. You don't see it during the mature phase, and you don't see it at the early phase as well. And this is something that is restricted to a city like Harappa. If you were to analyze a completely different city, you would get a different idea. So I don't think we have a good enough framework to be able to understand how you identify inequalities at a site. So for a place like Kalibangan, the understanding is that it being a smaller site, it was more production oriented rather than family oriented. So the nature of the housing then is dramatically different from the Harappan houses. They're very small dormitory style housing that you get. So how would you be able to identify differentiation? If you look at the artifacts that is found within the household, it is things that are being produced, not things that are being used. We don't, and very little bit of things that are used are actually found. What you find are things that are sent for trade. So how would you then be able to interpret it? And as far as things like nutrition or interpersonal violence is concerned, that kind of analysis was not done at Kalibangan. So I don't think there is a very concrete way of being able to talk about status differentiation here.
Farhad, go ahead, please.
I had a question for Amol. Yeah, fascinating presentation, and I absolutely agree that we need to look at inscriptions to recover health practices in the ancient period. But for us to be able to do so, I think we also need to take on this curious contradiction between textual evidence and the inscriptional evidence. I don't think it makes sense to argue that the textual evidence is all myth making. It has a crucial correlation to the truth of that period, or that somehow inscriptions provide a better historical context to the period than the literary sources of the period. So I think it is really important to go into issues of authorial intentionality to the production of the text, as also the intended audience, and how that shapes the nature of the narrative in the literary sources as also the inscriptions.
Are there any questions? We would see if there are questions on Zoom, right?
Take some time. I have one more.
No questions on Zoom? Okay, please. Just wait for the mic if you could.
Satish, when you were talking about plague, I don't know what the term you referred to in the inscription, because history of plague in India is very late.
No, what I said was that this is something that the scholars are assuming because there is no reference to symptoms in the inscription. But when they are trying to compare it to other terms that are found in the literary sources and where this term occurs, there are 2-3 symptoms that are there. And they have tried to compare those symptoms, for instance, in the Antonine plague that happened in the more or less in the same period that is there in the Roman this thing, and it affected the trade between Tamil Nadu and Tamil and Roman trade. So they have tried to compare. That's why I said that this is a very localized thing. And as Professor Deepak Kumar was saying yesterday, that people will not even know what the plague is. They will not be even to know that they have contracted plague. So what we know about plague is actually, you're right, it's a very late kind of understanding. But in that period, that's the nearest term that can be used for plague. That's why it's the plague but it's still an open question that whether it was actually a plague or something else.
No, when even Batuta is traveling,
Yeah.
he's referring to plague, and he knows that plague is there in Europe. He says that in Asia, he's saying at one place he's witnessing it. Then for the entire 13th, 14th, 15th century, we don't hear about it in India. Then comes Jahangir's intervention. When he's crossing Punjab and he's asking the people when he saw it first. So they say this is something very new. The gentleman who is reporting to Jahangir says that I'm 80 years old. I didn't find this kind of disease earlier. That also means it was absent.
I mean, just to add to that.
Just a minute, let me finish. What I would suggest is that we have to be very cautious in interpreting on using these terms. That's my suggestion.
No, you're right.
I just suggest we finish this fascinating conversation
Right.
to balance while we balance our humors and doshas outside with tea and coffee and refreshments, and allow our colleagues on Zoom to also take a little break. Please join me in thanking our many speakers for this panel for a fascinating session. And we'll see you in the next 15 minutes. Thank you very much, everyone.